Okay, our next presentation is the medical and educational options for those who choose not to vaccinate with Christina Hildebrand. Christina Hildebrand is the founder and president of A Voice for Choice Incorporated and A Voice for Choice Advocacy, Inc. She is a market researcher with a degree in statistics and analytical modeling. Christina owns a market research firm as well as a Weston A. Price-based food delivery service in the San Francisco Bay Area. Over the past 10 years, she has conducted over 10,000 hours of research on vaccines, including consulting with many leading vaccine researchers in a quest to understand the reality rather than the hype of vaccines. In 2015, in response to SB 277, the school vaccine mandate law in California, Christina felt that she needed to put the nonprofit onto paper and founded A Voice for Choice, Inc., the 501c3, and A Voice for Choice Advocacy, Inc., 501c4, in order to further her mission of ensuring all have informed choice and transparency into what goes into their body. Thank you, and here's Christina.
So thank you all for being here. I'm going to talk to you today, as Christy said, on the educational and medical options if you choose not to vaccinate. So once you've come to that decision or to slow vaccinate, especially living here in California, we don't have too many options of what to do next. I am going to put the disclaimer up, which I put up. It's not medical. I'm not giving any medical advice. I'm not giving any other advice that you should take and, and run with. This is just sort of an informational session on what do you do in the state of California and in the US if you choose not to vaccinate, both from an educational perspective, a medical perspective, and a work perspective, because we're seeing it coming into the workplace as well. I wanted to start off with sort of, you heard some of this from Teresa this morning, but this is the growth of the vaccine schedule from children from the late 1940s over this side, very small type, but all the way over to the present day. And it says total 69 doses. It's actually 70. I'm going to move this to the middle because I keep talking not into it. It's actually 72 doses if you follow the CDC schedule today for children. There are also 217 vaccines currently in the pipeline, which is very concerning. When you look at them, they're not actually for diseases, so to speak. They're for things like cancer, asthma, or not asthma, obesity, things like that that are not, and they're calling them vaccines because for vaccines you don't have to go through the rigorous testing that a normal pharmaceutical drug does because they're considered biologics. And so, we consider vaccines these days something for preventable disease. The things they're coming up with vaccines for these days are everything and anything. And I truly believe that a lot of that has to do with the fact that they don't have to be tested as rigorously as other drugs. This should be really concerning to anybody who has children. The growth, and we heard from Teresa this morning, the biggest piece of it is that the vaccine companies don't have any liability. So if you get injured by a vaccine, it doesn't matter to them. So they can put as many vaccines on the schedule and they don't have any liability. Forced vaccination is becoming a reality, and I don't say that half-heartedly. There are a number, especially in this country, there are a number of things that have come into place in the past probably 5 years that should be very concerning to everyone. One of them is that the HHS, the Health and Human Services, and the CDC basically have broad rulemaking authority to vaccinate if there is a threat, if they determine there is a threat. You can be quarantined, you can be brought in, and if you're not vaccinated, you can be force vaccinated. That is in our laws right now. Have they done it yet? No, but we're what's called boiling frogs. If anyone doesn't know that expression, you put a frog into a cold pot of water, you turn the heat up, the frog does nothing because they don't realize the water is getting warmer and warmer, and suddenly they're dead because they didn't realize it. That's what's happening to us in this country. And I don't say these things lightly. We also have, Obama signed an executive order in 2016 called the Advancing the Global Health Security Agenda to Achieve a World Safe and Secure from Infectious Disease Threats. Basically, their agenda is to push vaccines and to normalize quarantine. So when there is an epidemic, we saw it with Ebola a few years ago, it's, oh my gosh, you need to be in a bubble, and we're going to contain you, we're going to vaccinate you, we're going to just make sure that this doesn't, and infectious disease has become incredibly hyped, in my opinion. Do I want infectious disease? No. Do I want people to get sick? No, I don't. But at the same time, the measures that are possible for our country to take against us are pretty much unconstitutional, but they have been made legal. And then the last piece, which is probably one of the most concerning, is there's a thing called Healthy People 2020. They are currently revising it to become Healthy People 2030, which is basically how do we make America healthy? America's one of the unhealthiest countries in the world. We consume 75% of the pharmaceutical drugs in the world. Over 65-year-olds consume an average of 13 pharmaceutical drugs on a daily basis. That means there are people who are taking a lot more than that, and a lot of people who are taking less than that. But average is 13 drugs. One person, if you're over 65. One person, 13 drugs. Or no, that's the average. Anyone over 65, an average of 13 drugs is what they're taking. Pharmaceutical drugs is what they're taking in this country. Healthy People 2020, going to be Healthy People 2030 in the next few months, basically looks at how do you make America healthy. And two large pieces of that. One, vaccinate everyone, vaccinate every child, vaccinate every adult. And two is the whole electronic medical records. And I bring that in, and you may be like, well, what does that have to do with anything you're talking about? But the electronic medical records allow the government to track exactly what is wrong and right with you and exactly what vaccines you've had. And it is my belief that if we continue to go down this road, every adult will have to be vaccinated, and the easy way to implement that is you don't get your driver's license unless you show your vaccine records. This is reality, and it's a scary reality. I don't think we're there yet. I think we have a way to diverge it, but we need to wake up. We need to wake up, and we need to wake up not just the people in this room, we need to wake up the world out there, because it's a reality that's becoming real very quickly. And I say that having lived in California and living in California with SB 277, which basically took away our children's right to go to school unless they're vaccinated. I talk about the adult schedule. So everybody knows, kids have to be vaccinated. That's the time you get vaccinated. This is the adult schedule. And if you go to a doctor's office or Western doctor's office these days, they will pull up and say, well, you haven't had your MMR vaccine, you haven't had this vaccine, you haven't had that vaccine. Let's get you all vaccinated and up to date today. And these are the vaccines that they're considering. So you could walk into your doctor's office and need 5 vaccines, even though yesterday you thought you were perfectly healthy and didn't need any vaccines. I personally think this possibly is the tipping point where people wake up, because I think it's one thing going into a pediatrician's office and being told, your child, there are these awful illnesses that we'll learn tomorrow aren't really awful illnesses, but there are awful illnesses that your child, can be protected against. Once you're an adult, you're also much more aware of what happens to your body after you vaccinate and what happens to those reactions that you have. And so I think this is the point that's possibly the tipping point of where pharmaceutical industry, especially with the 217 vaccines that are in the pipeline, may have shot themselves in the foot. And I say may, because I'm not convinced the American population is going to wake up in time, but I'm hoping. This is why I do this. SB 277, going back to California. 2015, we saw 314 vaccine bills come into play across the US. California was the only one that passed, good old Catholic California. I am happy to say that there have been vaccine bills brought forward in other states since then, and none of them have passed either to take away the right to an education. Mississippi and West Virginia have the same no personal belief exemption, no religious exemption as us. So there are 3 states in this country where you must be vaccinated in order to go to school, unless you have a medical exemption. And in those 3 states, there's different qualifications for a medical exemption. SB 277 had 10 diseases that you have to be vaccinated for, 36 doses, which is the individual antigens, 21 physical shots going into the body. For private or public school, there are a few ways which you could get out of this. One of them is to be homeschooled. The first one on the list is being grandfathered in. So if you had a personal belief exemption at the time of SB 277 being passed until the end of that year, you could be grandfathered in until you get to kindergarten or until you got to 7th grade. And at that point, you have to either be caught up or you can fall into one of the other pieces of this. So the other ways are having an IEP, which is an independent education program. That is covered by the federal level of the Disability Act. Schools are temperamental on whether they will actually use that or not. The wording in SB 277 is iffy because it says you can get covered for the activities outlined in your IEP. Well, an IEP it says things like 50% of the child's time in recess should be spent playing with other children. So if that's what your IEP says, then for the other 50%, or the other periods that are not stated, does that mean you can't go to school at that time? It's very, very gray area, and schools have definitely looked at it and interpreted it differently. Homeschooling is another one. Conditional entrance really isn't not vaccinating. You have to, in order to get a conditional entrance, you have to have had the first set of every vaccine, the first dose or the first shot of every vaccine in order to enter school. And then there's a schedule that you have to take in order to get caught up. And then the last one is a medical exemption, and I'm going to go into more detail about the medical exemption. So school exemptions, I just talked about California. When you look at the whole of the country, as I mentioned, Mississippi, West Virginia, California are the only ones that have only medical exemptions at this time. The rest of the country has either a religious exemption and or a personal belief exemption. In those states, even in those states, there are different ways to qualify. So for example, New York State has a very strict religious exemption. You have to write exactly why you believe, what your beliefs are religiously, and you need to get it notarized, and you need to go jump through the hoops of getting that document into your school district. In California, prior to SB 277, we had a philosophical belief exemption that initially you just signed a statement. In 2013, I think it was, we had AB 2109, which meant you had to go to the doctor, and they had to explain the risks of not vaccinating to you. And the doctor would sign a piece of paper saying, yes, I've had this conversation, and then you can take that into your school. So the laws in each state, the vaccine laws for school are governed by the state. They're not federally governed. And so the laws in each state are very different. And so whatever state you live in is the state that, you need to find out what the laws are. I know Teresa's sitting here. I reference MBIC. MBIC has an amazing website that you can put in any state you're in, and it goes through exactly what the law is. It gives you the statute, what's in the law, how it's written, gives you all the information. So whatever state you're in, that's where I always recommend people go and get, the first, it gives you all of the information of what's there. The medical exemption also is very different in each state. So for most states, if you have a personal belief exemption or a religious exemption, most doctors don't even give out medical exemptions, because it's easier for you to just state that you have a religious or a personal belief against vaccines than to go to the doctor and actually go through the process of qualifying for a medical exemption. Now, most states have a medical exemption that is based on contraindications, or at least that's how the doctors read it. Contraindications, and I'll go into this, I think it's next. No. I'll go into it a bit later. The difference between a contraindication and being medically exempt for a vaccine. So I'll go into that. But most the contraindications are basically the CDC's reasons for not vaccinating. So you have to have an allergy to something in the vaccinations. You've had an anaphylactic reaction to the vaccines. And it's only to that one vaccine. So if you have an anaphylactic reaction to the DTaP, you're still fine getting the hepatitis B vaccine, even though it may have been the same base piece that caused your anaphylactic shock. The piece that I say, at the bottom of this slide is stand up for your rights. There are many people who don't understand, especially the schools, that don't understand these laws. And so especially in California, we've seen it in the last 2 years, I get calls constantly of, I gave my school a medical exemption, or I'm grandfathered in on a personal belief exemption, but I switched schools and the school won't accept it. And then, we write our little letter and send it, either give it to the person to send to their school. And most of the time the school, just didn't understand the law. And so make sure you fight for your rights and don't give in. Know what your rights are. Know what your rights are in each state or the state you live in. College and work exemptions. So for college, most of the colleges across the states use the same basis for their exemptions as what that state has for the lower level education for regular school. Here in California, up until this year, actually it's not even implemented yet, but they've got the policy in place, it's just they're not using it right now. All school, the UC schools, the University of California schools, actually didn't even have a vaccine policy because they just assumed if you got through school on whatever vaccines you had through school, you were good enough, whether that be that you had a personal belief exemption and you weren't vaccinated at all, or whether you were fully vaccinated. They just assumed if you made it to 18, you're good, and they didn't have a vaccine policy. Most schools, and I'll come back to the University of California of what they're doing, most schools now follow the state guidelines. So if the state has a religious exemption, most schools have a religious exemption. They don't advertise it. Just like in most states for real school, they don't advertise that there's a religious exemption. They don't advertise that there's a personal belief exemption. Some schools don't even realize that there is such a thing. But you have to go digging for it. It's there. It's more often than not, it's there. UC system this year, actually, they've been trying to implement it since 2016. They've been kind of doing it in a process, but it keeps getting extended because we keep complaining about it. The UC system decided that they were going to implement an immunization policy. Initially, the policy was even stricter than SB 277, so it was stricter than what our state has. It included three or four vaccinations. And it was you could only get a medical exemption based on contraindications. So we had A Voice for Choice, my nonprofit, had a huge letter writing campaign to the board or the person in charge of their health committee who put together the immunization policy. And we actually got them our two requests were to implement a religious exemption, which they'd never had because they didn't have a policy prior to that. And then the other one was to have the medical exemption be similar to SB 277, that was based on family history as well. They have made their medical exemption much more relaxed. So it is up to the discretion of your doctor now. And you can have not only a doctor or an MD sign it, but you can have a nurse practitioner. Basically, anyone who can administer vaccines can give you the medical exemption. So that was a win for us. And it still hasn't, it was supposed to be implemented this year. They didn't implement it this year. It's been pushed off to 2018. I actually wouldn't be surprised if it gets pushed off again. But again, they're not telling people that it's being pushed off. We have the information. We have a letter from Brad Buckman from the UC system that it has been postponed. But I get calls at least once a week saying, my child got enrolled at UC, whatever, and they can't go because they're not vaccinated. And I'm just like, they can actually go. They can completely enroll. They can go into classes, but they don't make it known. So the key here is find out your rights. Work out what really is the truth and stand up to it. And even if the school says, oh, we don't do that. We don't have a religious exemption. It's somewhere there. Just find it. For work. So work's an interesting one. They are implementing this slowly but surely. In California, the same year we had SB 277, we had SB 792, which basically mandated measles, pertussis, which is whooping cough, and the flu vaccine for childcare workers. The flu vaccine you could have a personal belief exemption for. Interestingly, that came about because one of the committee members in one of the health hearings, as it was going through our legislature, had an adverse reaction to the flu vaccine. So he said, well, hang on, we need a personal belief exemption for that. And I was like, okay, where are the legislators that have had the reaction to the other two? Because we'd like a personal belief exemption to the other two. We didn't get that. The interesting thing there is, so pertussis, you can never get just the whooping cough pertussis vaccine by itself. So you have to have diphtheria and tetanus to go along with it. And measles, you can't have measles. You have to have measles, mumps, rubella. And so it's actually, they only passed 3 different diseases, but realistically, they passed 7 different diseases that you had to be vaccinated for. There is a medical exemption that you can get for that as well. The place where we're seeing it not mandated, but forced, slightly different wording there, is in healthcare situations. So hospitals, doctor's offices, people coming in to sell products to hospitals now have to show their vaccination status in order to work. The situation there is that you're working for a private company, and realistically a private company can do whatever they want. If they want to have a rule that your hair has to be pink to go work at that company, they can make your hair be pink. You can file a lawsuit and go against it. And the nurses are the place where we've really seen people standing up against it in their workplace. And there have been some wins of nurses being able to not have to vaccinate. Now, instead, they have to wear a mask for the whole of flu season, which, you in my mind, you lay out the options of wearing a mask versus getting vaccine injured. I'll take the mask. But at the same time, it's also discriminatory because all the nurses who are wearing masks in that hospital 24/7, those are the ones that aren't vaccinated. So, it's a cycle here. But we need to break. We need to break this cycle, and we need to stand up. And in my opinion, this isn't specific to my talk, but it's what I preach every day, is everyone who knows anything about the truth about vaccines needs to be talking to everyone and anyone every day, because it's only when we get critical mass that we are going to get to a tipping point where this really becomes a question. To Chris Exley, who just talked about aluminum and the work that he's doing, they don't get funding for it. We need to get that funding going, but it's only when we have critical mass of people saying, we need to do research on aluminum. We have to do that research because it's not being done. We have to do research on autism because it hasn't been done. And so, it's getting that critical mass and knowing your rights, knowing what you can do. The other piece of this that is just horrendous and corrupt in my mind is the fact that your doctors, if you go to a Western doctor that is not on a holistic side or knows the truth about vaccine, they're being incentivized to give vaccines. This is a Blue Cross Blue Shield insert, small, but for every doctor on Blue Cross Blue Shield that has a 2-year-old up to date on all the vaccines, they get $400. The average, and I'm going to go to the number that's being thrown out there. Dr. Bob Zajac I don't remember where he is. He's somewhere in Minnesota. Thank you. He said that he does not vaccinate he doesn't vaccinate most of them. If somebody comes in and says, I want to vaccinate, he does it, and they want to be careful, he'll do it. But for the most part, he doesn't. He has calculated that he loses $1.7 million a year because he doesn't vaccinate the children in his practice on a regular schedule. The reason for that is our children are being taken into the pediatrician's office at day 0. They're in the hospital, they get vaccinated. 1 month, 2 months, 4 months, 6 months, 12 months, 18 months. Every one of those well-child visits, the doctor gets compensated for. Every one of those vaccines that they give, they get compensated for. If you get to age 2 years old, you get an additional bonus for having your patients vaccinated and up to date. the average number of children or patients that a pediatrician sees in the US is about 1,500, over 1,500 patients. There are some that see many more than that. There are some that see less than that. When you take 1,500 patients, and most of them are very young because we cram in those supposed well-child checks, really vaccination appointments, you've got the most of that coming between the age of 0 and 2. And so even if they had 100 patients that they're getting that they have in that 0 to 2, becoming 2 that year, that's $40,000 that they would make from this incentivization. So the fact that your child, and the other piece of it, which is down here, is the fact that they have to have at least a 63, and I've seen it up to 80% compliance rate in their practice. If they don't get to 63%, or whatever the number is, the magic number for that insurance, they lose out on all of their money. They lose out on that $40,000. So the fact that you're coming into an office and saying, I don't want to vaccinate my child, or I don't want to vaccinate them on schedule, it's not $400 that they're possibly losing. It's $40,000 or more that they're losing. And so when you look at this and look at the amount of money that is involved in this, not just from these incentives, but from the, coming in and having your children checked and vaccinated every single time, they're losing huge amounts of money if they don't comply with this. And it's the reason why if you don't vaccinate or you don't vaccinate on schedule, so many parents have been thrown out of their doctor's offices and been told, we can't take you here. We don't take anyone that's not fully vaccinated. It comes down to money.
Who's paying the bonus? Is it the pharmaceutical companies?
So the insurance is paying the bonus, but I can guarantee you there's I haven't been able to find how the money swirls, but I'm pretty sure that the pharmaceutical industry is involved there. So we look at medical exemptions, and I'm skipping to medical exemptions because the personal belief and the religious exemptions are really things that you can get pretty easily. You don't need help with them. A medical exemption, you need a doctor to sign a medical exemption. Here in California, it has to be an MD or DO, so it has to be a licensed physician. Doesn't need to be a licensed physician in this state. It can be from anywhere in the world. But you do have to have a medical exemption filed. As I said, West Virginia and Mississippi have their own way of doing it. Here in California, it's up to the discretion of the doctor. It then gets submitted to the school. The school is supposed to be the end of it. We know that the California Public Health Department has been going in and looking at those medical exemptions to determine whether they're accurate, determine whether there's too many being written by one doctor in a certain area. There's definitely a witch hunt. There's definitely bullying going on. It's why we have so few doctors that are willing to actually write medical exemptions in California. The same is true in West Virginia and Mississippi. It's close to impossible to get a medical exemption because they are more stringent, and there it doesn't get submitted to the school, it gets submitted to the health department, and the health department has to okay it. And so, in California, I feel like we're at least a little bit lucky that our medical exemptions are based on the discretion of the doctor. I say this is from a Voice for Choice, and if anybody wants to get a second opinion, if with anything else in your medical world, the question you say when you first get diagnosed is, should I get a second opinion? I'm not sure I really like what this doctor is telling me that I have to do in order to get better. I'm going to go get another opinion and decide whether I like that. I may get a third opinion or a fourth opinion too. I would say the same thing is true for your vaccine medical exemption. If you don't get if you walk into your doctor and they say, we don't do medical exemptions, we don't believe in medical exemptions, or I'm completely on board. I don't think your child should be vaccinated, but I'm not willing to put my medical license on the line, so I won't write you a medical exemption. This happens more often than I care to say. My answer is get a second opinion, get a third opinion even. And this is where our organization has helped probably over, I think it's about 1,500, maybe more than that, parents meet with doctors and get an evaluation based on their family history, based on previous, go into what goes into a medical exemption. But, there are doctors out there. There are a few of them, very few of them, that are actually publicizing. We have Dr. Sutton, who's got a table out there, who is wonderful, who, really is out there. There's a few others, but for the most part, most of the doctors who do this prefer to just stay back because there is a witch hunt going on. So as I say, finding the right doctor. Here in California, you have to have an MD or a DO signing your medical exemption. But I have parents that come to me and say, okay, I'm going to go to this doctor, get the medical exemption, but I really want a pediatrician that'll help my kids on a daily basis. And these doctors are either too far away, or they're not a primary care physician. They're not somebody that I can go to on a regular basis, or for whatever reason, they don't quite fit their family. And they're just like, I want an MD, I want a pediatrician who can, see my child. And my answer more often than not is, do you really want a pediatrician? Do you really want a doctor, an MD? Because in my mind, any of these other people are, and if you're going to look for an MD, then go look for an integrative or a functional medicine doctor, because they are looking at the whole picture. But I, more often than not say chiropractor, naturopath, acupuncturist, all of the above. Find the doctor that works for you in the modality that works for you and your children. And it doesn't necessarily need to be the person who is, who has that medical license. And it may be, you go, I haven't been to the doctor in years, but I go to my chiropractor for certain things. I go to my acupuncturist for other things. It's kind of, I know what I need to make sure my body is in the right place and getting the right treatment to be well. I kind of went into this a little bit. So here in California, the medical exemptions, I keep coming back to California because we're in California, but it's also what I live and breathe. And it's where, thankfully, not the rest of the country has gone, but there is much of the country, and it's being pushed out every single year. This year, I don't remember how many bills there were, but it was in most states, there were bills just being slammed on tightening up these exemptions. And even if it's not getting rid of the religious exemption or the personal belief exemption, it's, you need to have it notarized every single year. So it's just one more step. That's just one more piece that makes it harder to do. As I mentioned, contraindications versus being medically exempt. Here in California, that makes a difference. So contraindications, as I mentioned, they're what's in the package inside. So they're if you are, absolutely allergic to some ingredients, if you have had seizures or, some major event following vaccination, and it's shown that, there was a causation there. But again, as I said, if you have any of this to one vaccine, it's only that one vaccine that the CDC and the government says, oh, you're exempt from that one vaccine, but go ahead, have the other 10 while you're at it. In California, the way our SB 277 is worded on the medical exemption for schools is it is worded in a way that it is up to the discretion of the doctor. So it is up to your doctor to determine whether your child is at risk from the vaccinations. That includes the fact that if your child has never been vaccinated, they can still get a medical exemption, which for a contraindication you can't do. So for a contraindication, you have to have had the vaccine and had a reaction to it. For the medical exemption here, if you have family history of, family history of somebody else having a reaction to the vaccine, or if you have other genetic pieces, and I'll get into that more. And one important piece is that, as I said, it is up to the discretion of the doctor, and Governor Brown, in his signing statement, made that very clear. And so, that was, as much as SB 27 was horrendous, it was a tiny win for us on the medical exemption, because it means that, there is hope for people who have some other reason not to vaccinate that is not, I've had a reaction to a vaccine. What doctors should be doing, what every doctor should be doing across the country, across the world, and it doesn't happen except for these few handful of doctors that are really up to date on their research and really know the truth of vaccines is that they should be doing a risk to benefit of that analysis for each individual, child, adult, whoever, and really looking at that and looking at what is the risk of the disease. So what's the risk of me getting the measles? What's the risk once I've got the measles of me having an adverse reaction to the measles? It happens. You know, if your immune system's, it usually happens in people who are immunocompromised in some other way. It does happen. I'm not going to tell you. I don't want people to get diseased. Don't get me wrong. I don't want people to die from the measles. When it, you know, people, the other side of things go, you just are, you know, you're diseased. You want people to die from the disease again. We want to be back in the Middle Ages where everyone died from everything. We don't live in the Middle Ages anymore, but, you know, living in California. And, you know, the risk to benefit ratio is different if you live in sub-Saharan Africa, you know. So it's where you are at this point. It was where you're going to. You know, if you're going to a country that is ridden with some disease that's vaccine preventable, you may have a different risk to benefit analysis than you do sitting here today in this room. So looking at the disease, the risk of getting, the likelihood of getting that disease, which is very small these days for most of the things that have vaccines, and the likelihood of you having an adverse reaction. On the flip side, the likelihood of you having the vaccine. Now, once you've got the vaccine in you, you've got it in you. So you've got 100% right there. It's not the same analysis as getting the disease, because the likelihood of getting any of these diseases is low. Once you put the vaccine in you, what is the likelihood of you having an adverse reaction to that vaccine? Based on various, I'll get into it, but based on various different aspects. And I can guarantee you that living in this area or in any Western country with the clean sanitation that we have, with the clean water that we have, relatively clean water that we have, with the good nutrition that we have, or relatively good nutrition that we have, and with the Western medical system that we have, that if you did get really, really sick, that you could go to a hospital and get medical care. With all of those things, in today's age, in a Western country, there is absolutely no way that the risk is higher from getting the disease than it is from getting an adverse reaction from the disease versus getting an adverse reaction from the vaccine. You are much more likely to get an adverse reaction from the vaccine than you are of getting the disease and then getting an adverse reaction from the disease. And so that's the evaluation, in my point of view, what every doctor should be doing for every child and every adult in this country and in the world. And it's not happening. It's absolutely not happening, other than the select few doctors that are, you know, in the know of what the reality of vaccines is. When you look at the medical exemption qualifications, and again, I go back to California because every state is different, and for the most part, most states don't give medical exemptions. When you look at California, there is a form on that side that is the medical exemption. It's not a form that has to be used for the medical exemptions. You can have just a letter from your doctor, but it kind of goes through the vaccinations, and then you have to give a reason here in California for why you can't be vaccinated. It can be a very generic reason. It can be that you have a family history of neurological disease, and we tell our doctors that, you know, we work with, make it as general as possible because you don't want to, you know, it's medical information. So there are various reasons. So if you have a current or past medical issues, so just in general, if you are sick, you shouldn't be vaccinated. And that's, you know, that, if you go to the CDC website, if you go to any of the vaccine inserts, it is no longer. But it used to be, when vaccines started, that you absolutely don't get vaccinated, even if you have eczema. If you had eczema in the 1970s, 80s, you would never be vaccinated again. You wouldn't be vaccinated if you came in with a common cold. You wouldn't be vaccinated if you came in with any type of symptom that wasn't healthy. That's completely been thrown out of the window. And I would say go back to, you know, anybody that I talk to is just read the package inserts, read, you know, do your reading, and understand the immune system and how it works and what you're doing when you vaccinate, because it's an onslaught onto your immune system. Doctors should also look at, so here in California, we have this family history piece in the law. So they should be looking at family or personal vaccine reactions, whatever those reactions are. And most people, those reactions are not counted as reactions because the pediatricians blow them off. So that if you have if you or your child has a high fever and is screaming after vaccinations, that's just normal. Your child has a seizure after vaccinations, that's just normal. It's not normal. It is not normal for your child just out of the blue to have a 104 fever and be screaming. It is not normal for your child to have a seizure. Not normal. So don't agree with when the doctor says it's not normal. It's not. I mean, it's normal. It is not normal. So when you look at their chronic medical conditions, so family history, so all of these things can go into the determination of a medical exemption in California. Autoimmune disorders, allergies, asthma, atopic disorders, neurological disorders, inflammatory bowel disorders, developmental learning disorders, psychiatric mental disorders, cancer, infertility. And what the doctors who use family history will do is they'll look at so they'll take your child, the child's parents and the siblings, and the child's grandparents, and look at, basically do a family analysis of what diseases, what chronic illnesses, cancer, all of those things, vaccine reactions, those people in their family have had. And sort of determine, are you like, do you have and what it's really determining is, do you have a genetic disposition to get sick and get the autoimmune system triggered? And I'll go into that a little bit more in a minute. And then the last thing is titer testing. What do you want to?
A really quick question on the family history of these
Yes.
diseases, especially if the relatives are dead. There's no way to check the records.
So our doctors aren't checking the records at this point. So yes, you are correct, and it's hearsay. I mean, it's I know my grandmother died of leukemia. Do I have any record of that? No, I don't have any record of that. But and the doctors will take, if you walk in there and you come up with 50 million different disorders, they're probably going to think something of it. But for the most part, they take your word for it. There's also a genetic component to this. So if you don't have any history, or you have a child that's adopted, there are genetic tests. And many of the doctors that are giving medical exemptions are actually doing the genetic testing to dot their I's and cross their T's, because when the California Medical Board sends them a letter, not questioning their license or not saying anything, but says, we've noticed that you've written a lot of medical exemptions, and we just want to make sure that you have good records on all of those patients, period. We're not doing anything at this time, but we just wanted to let you know that we're watching you. Those letters have been written. So that's where they're doing the genetic testing, and I get into genetic testing in a couple of slides. The last one is titer testing. So titers are basically a strength or concentration of a substance in a solution. So for vaccine titers, it basically, and there's a lot of I say controversy, but I don't know if that, now I don't know which one's American, which one's English. I'm going to say controversy. Over whether titer tests and antibodies from the vaccine or from the disease is real. But I don't really care about that, because the CDC agrees that titer tests equal antibodies. And so if you show that you have antibodies through titer tests, so that you have had either the measles or you've had the MMR vaccine, and you're showing antibodies to that, you can get a medical exemption to that vaccine because you have the antibodies. So I'm not getting into the controversy of titer testing, but it is a way to get a medical exemption if you have those, and especially for the childcare workers here that have to get measles, pertussis. For those two, if you have the titers, then you are, you don't need to do anything more. Genetic testing, it's very new. It is being used by a handful of doctors here in California. It's something that I've done a huge amount of research on. I worked with Dr. Hicks, who passed away last year, and Yehuda Schoenfeld, who is doing a lot of research in Israel on aluminum and the aluminum adjuvants and autoimmune disorders. There are 3 tests that you can do. MTFHR is I'm not going to say the whole name, but it's a gene that basically prohibits methylation. Methylation is how you detox heavy metals out of your body and just detox in general. And so people who have the MTFHR gene, you can have 1 or you can have 2 of them, are not able to detox out of their body. So when they're vaccinated, they're not able to get that out. And so it builds up in them. And so one of the genes that's used with these doctors that are writing medical exemptions is the MTFHR gene, because it means that you can't detox the heavy metals that are in the vaccines. Other one is HLAs, human leukocyte antigens. That's the one that I've done the most research on. I need to stop and take a break and actually get it out into the public arena, because it's sitting there and I hate the fact that it's sitting there and nobody's using it. Although Yehuda Schoenfeld just wrote an article that was published that shows for HLA-DRB1, the first one on here, all the autoimmune disorders that are related to that gene. And basically what he said is, if you have this gene, any type of mutation of it, mutations are things that it basically shows your risk level for, or if you have certain mutations of this, you have higher risk for autoimmune disorders. So, one version of it is related to multiple sclerosis, another is to arthritis, another is to diabetes, another is to whatever. And what he's shown with his Asia syndrome is that when you have an aluminum adjuvant, which revs up your immune system, that these genes get triggered to the on position, and then your autoimmune disorders come in and start developing from them. And so some of the doctors that we're using that do these medical exemptions use the HLA testing. The last one that there is having an allergy to the vaccine ingredients. There's a huge number of vaccine ingredients. Sterling's app, Sterling, I forget her first name, but she lives in Louisiana, and she has created this app based on 23andMe, which is a genetic testing company. She basically has created an app that tests for your genetic propensity to have an allergy to all of the vaccine ingredients. And so many of our doctors are using that too, just to show, you have an allergic reaction to bovine cells, so you shouldn't be vaccinated. So that's it. The other piece that I will say is, and I give a big disclaimer on this, anytime anyone comes to me and says, well, I want genetic testing because I want a medical exemption. When you get genetically tested, you have to be aware that you now know what you and your child have a propensity for. And when you find out that you have the gene for breast cancer, for example, and this is not related to this, it is in a way, but if you find out that you have that gene, you then have some tough decisions to make. And the same thing happens with these. So if you have the genetic risk for multiple sclerosis or for arthritis or for celiac disease or for all of those things, what do you do with that information? And it's not that I say don't get that information, but just be ready and know that you're going to get information that could be life-changing. Keeping your health records private. I think this is the last slide. So once you give your medical exemption to the school, this is the next place where we have issues, because the school decides to give it to anyone they want. We have 2 laws in America. HIPAA is the first one, which basically when you go into any health practitioner, they make you sign a thing saying, yes, I'm compliant. They won't share any of your health records unless you sign a document saying, yes, you can share my health records with anyone. People say, well, the medical exemption should be under HIPAA. Should be, give it to the school and they should not be able to share it with anyone. Absolutely not, because you have taken it from your health professional and you have handed it to the school. So you have now given them authority because you've handed it to them. So HIPAA does not apply to medical exemptions at all. It's between doctor and you relationship. Once you take the information, and if I gave you my genetic testing to this room, that's not covered by HIPAA because I'm not a doctor, you're not doctors. FERPA is the other one, which is the School Records Act. So in a school, the school has to keep the students' records private. And this is where, with the medical exemption, we play this game between us and the schools, and Christy's she introduced me, her and I are in the forefront of this, where schools are giving out this information. They initially were giving it out just, here, have the medical exemption. We then went back, and there's a lawyer involved, but he writes a letter and says, you can't actually just give out the information. You know, the privacy of the student information needs to be blocked out. So they now are blocking out, you know, the medical exemption. They block out the student's name, their birth date, any other, private information. But basically, the rest of the information is there. The tough thing with that is that they still have the doctor's name, and that's what the California Health Department is going after, is these doctors who are writing these medical exemptions, because they want to crack down on it. They want to be in control. Go ahead.
So you have to fill out a special form?
Oh. So one of the things that we, A Voice for Choice, recommends doesn't necessarily hold you to it. But one of the things, this is a long website, but if you go to A Voice for Choice Advocacy and then you go to, I think it's in Issues, SB 277, and then it's dropped down, is that there is a form that we have that basically states that I do not want any of my students' records shared with anyone else. It becomes iffy because FERPA also says, well, if we're doing an audit, we can come in and get any information we want because it's an audit. So it at least secures it for a little bit. It means that the teachers, for example, shouldn't be able to review those health records and those records. It's a very gray area, and it's not widely followed, but we recommend putting that at least in your file so that you've got it if you need it legally to say, I don't want my stuff shared. So that's it, and I'm happy to take any. I see there are questions already, so I'm happy to take any questions and answers.
Yeah.
Thank you. Go ahead.
Hi, Christina.
Hi.
Alex Meyer. So a comment about the genetic testing. Through 23andMe, we can also find out about mitochondrial function.
Yes.
Does that count toward an exemption or not?
So for the doctors that are that are open and aware of it, yes, it does.
Okay.
The one thing I will say with 23andMe and with any other genetic testing that you have done that is a kit that you send in, be very, very careful about what you click for disclosure, because 23andMe, for example, sells your genetic testing information. It's anonymous, but they sell it to the government. So if you don't want your genetic, and it goes all back to the medical records, and it's supposed to be anonymous, but there's always a name linked somewhere along the line. And so just be careful. You can check off that you don't want it shared with anyone, that you want to keep it private and all that. And so if you do 23andMe, I absolutely recommend, if you have any concerns about privacy, that you make sure you check them. But yeah.
Okay. So a question next. My kids are in high school getting ready to go to college. They have medical exemptions. And have you found that California medical exemptions will work in other states?
So most other states, you don't need a medical exemption because they have religious or personal belief exemptions.
Okay. And then you said that for colleges, anyone who could administer a vaccine can write an exemption?
So for the UC?
For UC.
For UC. So UC is the only one that has a really strict, it's not implemented yet, but a really strict vaccine immunization policy where they don't have a religious or personal belief exemption. And for the UC, anyone who can administer a vaccine, there's a list of who it is, but it basically comes down to anyone who can administer a vaccine can write a medical exemption.
So a pharmacist at Walgreens?
Yes, I don't know that they would.
Okay.
But yes.
Okay. Thank you very much.
Yes, you're welcome.
Hi, Christina.
Hi.
Thanks, Christina. There are a couple of physicians in my county, and one of them is going the saliva test, the blood test, for children for writing exemptions, and the other one is going for conversation. My kids are little, and I don't want them to lose their pound of flesh in order to get this ME. I chose the conversation option, which is more. I feel like I have a paper shield. That they're going to come after this doctor, they're going to come after me. Which is more viable? Should I get a second and a third medical exemption in order to walk down the street?
When they come after the medical exemptions, there is a chance that next year, Senator Pan, if you read any of his Twitter feed, you will know that he's going after medical exemptions. There's
You'll
a chance
also go crazy.
Yeah, that the medical exemption will be tightened up. I don't think it'll pass, but there's a chance that they'll bring that legislation forward. I don't think at this point, I don't think any doctor, one doctor's medical exemption is better than the other doctor's medical exemption.
Okay.
The one thing you have to realize is that a doctor, in order to be brought before the California Medical Board, it's usually a patient that has to complain. And so for the two doctors that have been brought in front, one of them, Dr. Hicks, didn't get brought in front because he died before he could get to in front of the California Medical Board, but for Dr. Sears, who's down in Southern California, he was brought forward because divorcing parents were arguing over the validity of the medical exemption, and so that was the reason for it. Dr. Hicks, the same thing. It was a divorcing couple that one parent didn't like the medical exemption. And so, I think all of our doctors are being bullied. They're being witch hunted. They're being told, we are watching you. But to get them to actually be brought in front of the California Medical Board and have their license taken away, it's harder to do than just, let's do it.
Thank you.
You're welcome.
I heard that most doctors don't know the ingredients of the vaccines themselves, and that people should ask for that list and the side effects. And being that these side effects, which there are plenty, can that be used as against in terms of a medical clause saying that the side effects from the disease are less than the probable side effects from the vaccine, giving the information from the ingredients of the vaccines?
So I think the doctors that are aware use that information. The other doctors who are being paid are not willing to look at that information. I think it is a very hard reality. I think the other thing, during SB 277, there was a point where I was so angry with the doctors, and I was just like, they have to know better. They have to know better. But what you have to realize is that most doctors have two hours of training on vaccines in their medical career. And during those 2 hours, they are told the CDC schedule. They're shown pictures of these kids with these awful diseases, rashes all over, bloated all over, just horrible, paralyzed, horrible-looking kids, and how to administer 5 vaccines at once. So one goes here, one goes here, one goes here, one goes here, and then another one goes somewhere else. And that's what they're taught in medical school about vaccination, and that they're completely safe and effective. So when I look at what doctors know, they don't know. And they don't have the time to do the research. The people that they get all of their information from are the pharmaceutical reps. I mean, if you're in a doctor's office, they don't have time to get sit there and come home and do the research. If they're coming home and doing research, they're the doctors that are on our side already, because they've done the research on a multitude of things, not just vaccines.
What about informed consent? Because if you're asking for the information, they're giving these vaccines saying that they're good for your child.
Yep.
But that's not really informing the parent.
Right. So the informed consent piece comes from the vaccine information sheet. So in 1986, when the law was passed, it was that the vaccine information sheets had to be given to every person getting a vaccine. They are, if you've read them, they're a 2-page flyer. It's been reduced over the years that basically says the symptoms of the disease. It says the risks of it says the symptoms of, or the side effects of the vaccines, but it only gives the most common side effects like swelling and redness and a fever and those kinds of things. And it does say, it gives information about VAERS, which is the vaccine where you report vaccine reactions.
Do you know when they started doing that? What year?
Sorry? Do I?
When they started giving these sheets?
Yeah. Do I know when?
Yeah.
It was after the 1986 Act.
Okay, thank you.
Wasn't it? You're nodding or you're not nodding. Yes, make a clarification, please. Teresa is my NBIC person that knows all the information on this one, so.
So first, it was after the Act, but there's a difference between informed consent and informed consent protection. The VIS is a protection, but it is not what informed consent actually is. Informed consent is your ability to do that risk-benefit analysis from both the side of the vaccine and the side of the disease, like Christina has already mentioned, your voluntary consent, and that there are no sanctions, meaning you're not punished. That is the informed consent ethic. It's guided the ethical practice of modern medicine. What's in the law and what our co-founders secured was an informed consent protection that prior to the law, a doctor did not have to say to you, there's a risk. Okay? The federal law requires that you're handed that sheet prior to vaccination. And Christina's right, it was terribly abbreviated in 1993. But don't mistake the VIS as informed consent.
Right,
They're two different things, okay?
Thank you, Teresa, for the clarification. I'm going to tell you, we need to be quick because I have no more time. But
quick one, Christina. For family history, to get a medical exemption, could cousins of the child be considered? Do you know?
They are. So they are. It depends on the severity. It depends on whether you can link it up to. So if they're not blood relatives, then no. Okay. So if it's something that's genetically through this, and that's why I said the sisters of the siblings of the parents, because that's genetic. So if it's if it's MS through the cousin's other parent, then it doesn't count.
Right. Okay.
Yeah.
Thank you.
Can a medical exemption be extended beyond age 18 for a lifetime with the threat of healthy 2030 coming?
Yes, the issue there is that we have no idea what. So the medical exemptions that are written for school are very specifically worded, and so
18.
What?
The one I have says 18 until reaches age 18.
Okay, so you can get a medical exemption that's forever, but the thing is, if there is a medical exemption that's written for school wouldn't necessarily carry over for the childcare teacher, because it needs a different set of information included in it. So the exemption, the fact that your doctor exempted you is fine, but the letter may not transfer over.
Yeah, how to get it extended is what I'm hoping to do. Yeah.
If you go to the doctor, there's nothing at 18 that makes you, less
change.
susceptible. Yeah.
Right. How can we go on a Dr. Pan witch hunt? Because I think it's time to turn the tables on him. Clearly.
I'm not going to answer that one. I will.
But
I have many ideas
it
on
needs
that one,
doing. So.
He's up for election next year, so there's an opportunity to get rid of him.
And that's
1 second. Go ahead.
So when you're already in, for instance, I'm a 7th grader with a medical exemption, and a doctor said for life.
Yes.
Do I, after 7th grade, have to?
No, you don't need to do anything. You're fine for life. Until something else happens, yes.
Oh, Christina, I'll precede what I was going to say with do your witch hunt at the ballot box.
Yes.
Right. And I wanted to ask you, I missed this when you said it. Are you using Sterling Hill's screening method? And
yes.
That's
so
one.
Some doctors are, yes.
Okay. And then another thing was that Sterling was going to start doing genetic profiling, and she will not share with anybody.
Correct.
So that's
yep.
good. And then third thing, would you encourage people to sign the petition about cleaning up the vaccine?
Yes, I will mention that. So on the table out there that has the Physicians for Informed Consent information, there is a petition that Stephen put together that is basically to clean up and get the he's our glyphosate man, to get the glyphosate out of vaccines. So glyphosate has been found in vaccines, and so it's to get that out of vaccines, and it will be hard to do. So it's a bigger issue, but if we can target that issue. I need to. I'll keep talking, but I'm going to be thrown out of here in a minute.
Did it pass that the people who do eye exams get to do the vaccines?
Yes.
Oh, so they can give exemptions?
Not for California. For UC schools, they may be able to. They weren't included in there, but for California schools, it can only be an MD or a DO.
Okay. But the other guys are giving vaccinations now.
Yes, right? So optometrists in the state of California, the governor hasn't signed it yet, but I'm pretty sure he's going to. There's an optometry bill that allowed optometrists now to be able to give vaccines. Only a few for adults, for adults. And it's only 3 vaccines that they're allowed, but, we'll expand in the future. So that's not, it's not necessary, you don't need to get them notarized. In certain states, like New York, you have to get your religious exemption notarized. And there are other states that have every state is different, so you just need to look at your state and what you need to do to comply in your state.
Follow-up question, if you think you might have a legal battle at the
a legal battle, custody, or?
Yeah, over custody is going to take you toward vaccinations, which is very.
So I will say most doctors who are giving medical exemptions will not give them to people who have custody issues.
But if they do,
and if they do, notarizing it doesn't make a difference. I mean, it's written by the doctor. You know, I'm going through a divorce, or no, I've gone through a divorce. I'm going through the whole vaccination custody piece, and it's a whole different world. So if you need to talk about that, you can contact me separately. All right, thank you so much, and enjoy the rest of the conference.